Hello, welcome to Chapter 17, Assisting in Obstetrics and Gynecology. Let's look at our learning objectives. This will be divided into two parts. We're looking at 17.1, Anatomy, Diseases, and Disorders of the Female Reproductive System. We'll define, spell, and pronounce terms listed in vocabulary, explain the anatomy and physiology of the female reproductive system, compare and contrast current contraceptive methods, summarize menstrual disorders and conditions, distinguish among different types of gynecologic infections, do the following related to benign and malignant tumors of the female reproductive system. We will differentiate between benign and malignant neoplasms of the female reproductive system, prepare and assist the female examination, including and obtaining a Pap test, demonstrate patient preparation for a loop electrosurgical excision procedure, which is LEEP, L-E-E-P, teach the patient the techniques for breast self-examination, and compare positional disorders of the pelvic region. So obstetrics and gynecology is a branch of medicine that deals with pregnancy, labor, and the postnatal period. And this is obstetrics. The branch of medicine that deals with diseases of the genital tract in women is called gynecology. Do you know what the abbreviation for a physician who practices both of these specialties? Correct, it's OB-GYN. Patients often hesitate or are uncomfortable about talking about sexual matters, so they wait until symptoms are intolerable or if the disease is advanced before seeking the medical care a lot of times. So it's important that in our patient education and patient support that we make them feel comfortable and we help them to make sure that they attend their appointments regularly as needed. Here we see figure 17.1, and this is looking at the female reproductive system. You can find this in your book and go over the reproductive system in more detail. The female reproductive system includes both internal and external organs, as we see here. Looking at the uterus and fallopian tubes, this is figure 17.2. So what is the lubricated tube-like structure constructed to receive the penis during coitus? Correct. It is the vagina, which connects the internal and the external organs. The uterus is an upside-down, pear-shaped, muscular organ, and its sole purpose is to house and to nourish the fetus from implantation shortly after conception until parturition. The uterus has three layers: the endometrium, the myometrium, and the perimetrium. Let's look at the fallopian tubes. The fallopian tubes extend from the uterus to the ovaries, but do not attach to the ovaries. The distal end of the tubes open freely into the abdominopelvic cavity and acts as a passageway for the ovum, also the egg, to the uterus, and for sperm as they search for the ovum. There's finger-like projections called the fimbriae, and they move in a wave-like pattern to draw released ovum into the fallopian tube. Another name used for fallopian tubes is the oviducts. The ovaries are almond-shaped organs that produce and release the ovum. The ovaries excrete hormones necessary for the development of secondary sexual characteristics and maintenance of pregnancy. The hormones that are secreted by the ovaries are estrogen and progesterone. Fertilization. For fertilization, for pregnancy to occur, the vagina must receive sperm from the male, and the sperm move up through the opening of the cervix and through the uterus into the fallopian tubes. The fertilization occurs when one sperm cell penetrates and fertilizes an egg. And then these tiny fertilized ovum, zygotes, move by peristalsis and a massaging motion of the cilia that line the fallopian tubes into the uterus and implants itself into the uterine wall. Then the placenta forms to nourish the embryo. Once pregnancy begins, the serum level of the human chronic gonadotropin, or HCG, rise, and the hormone spills into the woman's urine, where it can be detected with a pregnancy test. And that's why our pregnancy tests are HCG tests, because we're testing for that hormone. Breast tissue. So mammary tissue develops from an increased estrogen secretion that occurs during puberty. The nipple is surrounded by a pigmented region called the areola. There are 15 to 20 lobes and they're subnits. The breasts contain mammary glands, modified sweat glands that become organs of milk production when the female is pregnant. The amount of distribution of adipose tissue determines the size and shape of the breasts. Mammary ducts respond to the elevated levels of estrogen and progesterone produced during the menstrual cycle by increasing in size and resulting in the premenstrual fullness and tenderness of the breasts. In figure 17.3, we're looking at the normal female breast tissue, so take a look at this more closely in your book and read the sections with it. There are 4 hormones that control the mammary gland. They're estrogen, progesterone, prolactin, and oxytocin. Now we're going to talk about contraception, also known as barrier methods. So contraception is built to either kill sperm or prevent them from entering the cervical os. We're looking at those condoms, diaphragm, cervical cap or sponge, and these must be used every time intercourse occurs. The cervical cap is a thimble-sized domed barrier device that fits over the end of the cervix, so it protects. These methods have varying degrees of effectiveness in preventing pregnancy, and you can look at table 17.1 to see commonly used contraceptive models or methods. Hormonal contraceptives, these inhibit ovulation, change the cervical mucosa, affect sperm mobility, and prevent the thickening of the endometrial wall. Included birth control pills or the patch, vaginal ring, Depo-Provera. Oral contraceptives also treat menstrual irregularities, so they are sometimes given for PMS symptoms, ovarian cysts, and oral contraceptives must be taken daily to be effective. So if they are not taken daily, they are not effective. They do have some side effects, and it's important that the doctor discuss the side effects. Some of them might be, they can mimic aches, abdominal pain, you can sometimes have chest pain, headaches, eye problems, blurred vision, and severe leg pain. And these all need to be reported to a physician immediately if you're having these side effects in a more severe way. Hormonal contraception also can be delivered via a transdermal patch. In the vaginal ring, we talked about like a Nuva ring. This is a contraceptive device that is made of a flexible plastic and it's inserted into the vagina. Depo-Provera is an injectable, so if they're using Depo-Provera, they will be getting a shot for the Depo-Provera. There are intrauterine devices This is figure 17.5. So this is the Mirena IUD that it's showing here. IUDs work to inhibit fertilization by blocking the sperm's journey to the fallopian tubes. And if fertilization does occur, they prevent the embryo from implanting into the uterine wall. Some permanent methods: bilateral tubal ligation. This can be performed, which a portion of both the fallopian tubes is excised, ligated. This is riskier and more costly than the male vasectomies. In general, anesthesia is required. Also, hysterectomies are another form of permanent methods. Let's talk about endometriosis. You can look at figure 17.6 in your book, because I know that it's not as closely seen here. Endometriosis is characterized by the presence of functional endometrial tissues outside of the uterus. Endometriosis causes inflammation at the site that reoccurs with each cycle, ultimately leading to adhesions and obstructions of the affected tissue and can lead to infertility. Here we see some infections, and you can read more about this specifically in your book. PID, pelvic inflammatory disease, cervicitis, bacterial vaginosis, candidiasis, which is also more commonly known as a yeast infection. Yeast infections are cured with antifungal medications, whereas bacterial vaginosis, BV, and cervicitis can be treated with antibiotics. PID is treated with broad-spectrum antibiotics. Sexually transmitted infections, you can see again figure 17.7 illustrates the sexually transmitted infections, and you can see here, if you look in your book more closely, you'll be able to see the samples. So ascending infections of the female genital organs are usually caused by sexual contact, pregnancy, or instrumentations. Human papillomavirus, or HPV, can cause genital warts and lead to cervical cancer, and there now is a vaccine for HPV. So what is available to prevent the HPV is the vaccine. It's called Gardasil. It can protect women from the 4 HPV types that cause the majority of HPV-related cancers. The HIV infection, the rate of infection in females is declining. It can be transmitted to fetus during pregnancy if medication is not used, and HIV can be passed to a baby during breastfeeding. Because some AIDS drugs are very dangerous for developing infants, the medication regime of a woman currently receiving treatment may be changed during pregnancy in order to make it more safe. Benign tumors or fibroid tumors. Uterine fibroid tumors are composed of hormone-sensitive cells and are designated by, depending on their location. Heavy excessive bleeding or menorrhagia is the primary symptom, although patients may experience bladder or rectal pressure, pelvic pressure, pain, abdominal distortion, and even infertility can be signs. Benign tumors like polycystic ovary system can be diagnosed. It depends on the presence of 2 or more indicators, including irregular or no menstruation and high testosterone levels. Ovarian cysts are usually benign. Larger cysts causing symptoms can be treated with birth control pills or surgery. And the polycystic ovary system causes cysts to develop over enlarged ovaries and is linked to a greater risk of type 2 diabetes and heart disease. Here we see fibrocystic breast disease. Fibrocystic breast disease is characterized by the presence of multiple palpable nodules